Hello, welcome to Nature Source Care. This is Dr. Funda Goldman. Today I was going to be discussing homeopathy for a healing crisis. And by healing crisis, I'm talking about letting go of deep mental, emotional, and spiritual states, old energies, and then reintegrating at a higher level. The specific remedy I was going to be talking about today is called the Bach Flower remedy, Cherry Plum. So let's get started. Please note beforehand that the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that persist or worsen, please consult with a qualified medical professional. And it's always best to determine the root cause of any disease and to develop a comprehensive treatment plan, of which Bach Flower remedies can be an important or effective part, but they might be only a part of a plan. And while homeopathy, Bach Flower remedies can be effective, they may not always be appropriate for everybody and may not be appropriate or effective as a single therapy. So please keep that in mind. So a little bit of background on Bach Flower remedies. Generally, Bach Flower remedies are considered a kind of homeopathy, which is a whole paradigm of energy medicine. If you're interested in more background and history on that, I would look at my first Bach Flower remedy video, Walnut. That's available. The general concept, though, of this type of therapy is that disease stems from an inner struggle. And so when we're looking at energy medicines, what we're looking at is that basically these states of health and disease are seen as types of waves or vibrational energy. And so when we give a vibrational energy, it helps to, you can kind of think of it as smooth out that wave and create higher states of health. So it might be a little bit vague if you haven't used these before, but it's a whole different paradigm. You kind of have to wrap your mind around a different way of thinking about health and disease. Yeah. So what I have found in my practice, though, over the years is that Bach Flower remedies can be particularly effective for mental, emotional, and spiritual conditions. If you're interested in this type of content, I would look at my homeopathy and Bach Flower remedies playlists. I'm pretty good at organizing my videos so that they're easy to find. Excuse me. And then the other thing is that since it's Christmas, I have another video that I made, I think it was last Christmas, and what came to me as being sort of funny or ironic is that I wasn't actually planning, I don't think last year, planning on doing a video on Christmas last year or today, but was feeling inspired. Maybe it's the Christmas spirit. But in any case, it felt important to do this today and share it with you. The video I did last year on Christmas is actually the Bach Flower remedy on holly, which is, appropriate for the season and the holiday. And that one, holly is used for, I did discuss how it's used to open your heart to higher states of love. So you might be interested in that as well, if you're sort of in the mood for the season. So let's talk about cherry plum. And the symptoms you might find and kind of underlying issues or movements of energy that are at play here and holding somebody back. So the key note with cherry plum is that you feel like you're going to lose control over yourself. That's the main one. And so what's going on a deeper level? Why does somebody feel like they're about to lose control? Well, they've created systems, thought processes, systems, survival mechanisms, if you want to think about it that way, to suppress deeper healing energy and growth. Because and part of that is that there's a fear of letting go. Part of it might be, and there are different reasons why somebody might fear healing. One is that healing can bring about states of discomfort or even pain, whether it's physical, mental, emotional, spiritual. And so there's sort of a conscious or subconscious resistance to that. The other thing is that people I've seen, like with homeopathy, I remember giving a remedy to somebody, a woman, who was kind of complaining about her job and her work and that area of her life. And I remember we were kind of going around and around, she was kind of being evasive and stuff. And I gave her a remedy. And I believe it worked, because she started making movement, new kind of shifts, change, actions, different thought processes regarding her work. But then she shared with me that she thinks part of the reason, and this just came spontaneously for her, I wasn't asking for it. She said part of the reason why she thinks she might have been resistant is because as she was moving into deeper states of health for herself, part of what was not resonating with her anymore, or something that she could not look at anymore, was her relationship with her husband. And so she feared how that might change things with her husband if she allowed herself to grow and heal with her incoming complaint of issues with work. So, the mind, that not just the conscious mind, but the subconscious mind is doing all it can to prevent pain. And again, these survival mechanisms are in place for a reason. They worked for a while. But then the phrase I usually use with patients is, it's sort of like, once you cross the desert, or once you cross the river and you're in the desert, you don't really need the raft anymore. So again, these, we can appreciate these survival mechanisms. They kept us safe. They got us to whatever, 10, 20, 50 years of age. But at some point, these same survival mechanisms might be holding us back from the next level of our development. So you can think about that. So cherry plum, though, specifically. So what might you see with a cherry plum case, or somebody demonstrating cherry plum type symptoms? Well, it may be conscious or unconscious, but there's fear, and they might fear saying or doing something that they regret. Like they might completely lose it and, say something to their loved ones or their boss or something like that, and then lose their job, that kind of thing. They may fear blowing up, being violent. They might fear emotional outbreaks, tantrums, or, breakdowns. Which is a distinct possibility for some people. So if that is the case, that there is a true threat of that, you want to make sure that you have safety protocols in place for this patient. Another thing is like cases of PTSD. So people who've worked in trauma, in the military, first responders, people who are seeing a lot of really pretty difficult things to mentally, emotionally, spiritually digest and process and clear from their system. All that stuff, gets stuff down if it's not actively processed. And so what happens is there's so much trauma that it weakens the kind of personality structure or defense mechanisms, survival mechanisms. And so when that person gets into a situation that reminds them of past events, then that stuff can start bubbling up to the surface, and then they might have a panic attack or something like that. So because there's so much trauma in those sorts of situations, and there's just hit after hit on the personality and mental structures that keep somebody intact, at some point they might kind of like either explode or implode and kind of give up. So that's a possibility. Then you might also find somebody with compulsive ideas or delusions, just thoughts going round and around in their head. And this is actually a survival mechanism, because when you're up in your head, and this could even be an athlete actually, like a lot of long distance athletes, or athletics, if you're really like high up there, you're probably creating pain, in your body, on some level through training or through performance, to achieve a certain thing, goal, medal, whatever. And so you have to like basically dissociate your mind from all those pain sensors. At least that's normal. Most people's pain threshold is too low to go through that sort of rigorous training. despite all the rewards and stuff to it. But so actually, for people who are have the ability to dissociate, meaning that they sort of disconnect their mind from their body sensations, and this again might be another survival mechanism, through trauma as a child or something like that. It works for them as like an athlete, and then they accumulate all these medals. But it might also be disruptive because maybe they dissociate in their personal relationships, and that can be an issue, right? So in any case, so the compulsive ideas, I almost skipped over that. So, when people have compulsive ideas or ideation, basically it's like their mind is spinning. And so because their mind is spinning, all the energy is up in their head and it's not in their body, where they can actually, so they don't feel these things. Like their mind might be whirling and it might be annoying and distracting, but they won't actually feel the pain. So it's, kind of, it works to not feel pain, but it also doesn't work because your mind is spinning. Other things, so violent, destructive thoughts or images come to their mind, but they're not always linked to feelings. Again, that sort of dissociative quality. Somebody might also have issues with like nighttime, things happening at nighttime. So things like bedwetting, teeth grinding, sleepwalking, because all of that is typically, not always, like bedwetting could be like an infection or something like that, but teeth grinding and sleepwalking, and sometimes bedwetting, a lot of that comes from, not having completely processed the day's events, short term or long term. And so that sort of unconscious stuff, it's still sort of bubbling under the surface. And the only time it has a chance to kind of come up and be released, or at least sort of, show its face, is when somebody's, sleeping and they don't have full control over themselves anymore. So again, that's sort of, another example. When somebody's dealing with addictions and they're looking at the deeper issues driving the addictions, whatever the addiction is, drugs or Facebook or sugar or whatever, shopping, it can be anything. Again, the addiction is basically like a really destructive distraction from the underlying pain that probably wants to be resolved, but the person on a conscious or subconscious level is not ready to deal with. So sometimes too, when there are obvious triggers or being reactivated, like maybe you had a car accident and you're still not able to drive because it elicits fear, that sort of thing. When we're looking at trying to help desensitize people to things, sometimes it's or like fear of flying, sometimes it's too overwhelming and people can't get to the other side of actually being desensitized. A remedy like this might help in working through those deeper fears, of crashing again or whatever it is for them. And it can also support deeper release and insights, epiphanies that come from things like psychotherapy, yoga, meditation, those sorts of things that just are meant to help release old thoughts, feelings, memories, anything that's disturbing the psyche, the being at large. Yeah. So the risk, if somebody stays in this sort of state, without some sort of support, is that by suppressing these darker feelings, they're also suppressing the light of healing. So they stay stuck in this kind of loop. Yeah. The potential outcome of taking a remedy like this is that deep healing does occur, forward movement does occur, there's increased energy and clarity, because the energy of that old mechanism of like keeping somebody from danger, that's essentially what it was, is again outmoded, and it's preventing them from moving forward, because at some point to do great things you have to take a risk. So they're able to handle growth and change with greater composure. They have greater access to personal insights. They'll be helpful and educational for them. And they're more able to engage in spontaneous and playful actions, because spontaneity and play, it's like, if you're so controlled, and again, it worked for you when you were younger, but now it's getting in the way, that's again that suppression. It will prevent you from feeling as much joy, and living an adventurous life and potentially excitement and all those other sorts of states of being that can happen more easily when you're able to let go. So there you have it, cherry plum, how it looks when it walks in front of you as a person, and the potential healing potential with this remedy. So there are other Bach Flower remedies that help with fear, but they're specific in their approach or in their effects. And so yeah, I always say, especially with the Bach Flower remedies, it's really all about, diving deep into this person, like what's the core issue? Because again, it's like, I've listed another 4 here. So when we look at somebody's fear, they're afraid, but like, why are they afraid and how is it manifesting? So if you can tap into that subtlety, then usually choosing a remedy is easier. So I did actually do another video on Aspen, which is about fear. So Aspen is about generalized fear. It's kind of like they're always fearful of everything, that sort of thing. Specific triggers are unknown. They're very vague about what triggers them. Part of this is because they have a lack of boundaries. They're like a sponge. They soak up all the energy around them. So there's a thin, kind of membrane between them and the rest of the world. And they're also hypersensitive. So again, they're picking up on everything. And so part of the fear is just they're processing energy that's not even theirs. So if you're interested in that remedy, check out the video. 3 other fear-based or fear-indicated Bach Flower remedies. I haven't done videos on these yet. I guess that maybe they're next or soon. Mimulus is used for specific known fears. So when it's kind of more concrete, like, oh, I'm afraid of snakes, or I'm afraid of dogs, or something like that. Red chestnut is used for fear, but that's when you're concerned about others. So this is maybe like a parent who's always fearful, like something's going to happen to their child, that sort of thing. Rock rose is another fear-indicated Bach Flower remedy. This is for like terror, panic from external emergency situations. So like just in the news, for too long now, the Ukrainian war going on. I'm sure a lot of those people, especially when they hear, bombs and, missiles, things exploding around them, that's kind of a situation where rock rose can be indicated. Yeah. So the other thing is there are actually quite a few other energy modalities besides Bach Flower remedies that I've used successfully in my practice dealing with people's fears. Homeopathy generally, not just Bach Flowers. Bach Flowers are sort of a subset of the greater umbrella of homeopathy. There are quite a few indicated for different sorts of fear. Yoga and meditation, if you get into it more beyond sort of the more exercise aspect or component of that type of practice, yoga and meditation, those are part of why they're effective with getting people to deeper levels of calmness and peace or higher levels of consciousness, is because they're helping to, what do they always say, peel back the layers of the onion, right? Release more old stuff. If you release more old stuff, then you're not as constricted by the old stuff, and you can be more spontaneously yourself, and also more authentic in your true being, not just something that you sort of devised, over the years as a response to the world, but who were you really, before the world took you over. Ayurveda, especially fear-based stuff, Ayurveda would look at probably, a few things, but if it's fear-based, typically we would look at Vata, reducing remedies and therapies. Vata is considered sort of an excess of wind in the body and the mind. It could also be, if there's violence involved, if there's an anger component, you might have to do with Pitta. And if it's memory-based, you might have to do with Kapha, or Kapha is the earth element, because it's sort of like the like they describe in the mind, that this almost like this clay tablet where all the sensory impressions get kept, records of them. And so to really alleviate, long-term stress, memory-based fears, you also have to kind of work with that. And then Marma therapy. I have a bunch of Marma therapy videos. I'm actually getting to the end of covering all the Marma points. Marma therapy is essentially like acupressure, but it comes from traditional Indian medicine or Ayurveda. There's 107 points on the body, and so by working with those points in different ways, you can help balance the mind-body organism. Yeah. So lots of other ways of helping people with their fears. So there you have it for today. Cherry Plum Bach Flower Remedy. I hope that you found this video helpful, useful, interesting. Yeah, and also, I don't know if I've mentioned, but I have another YouTube channel, and that one is on Vedic Astrology, and the name of that channel is Light Vedic Astrology. So if you're interested in Vedic Astrology, you might give that a look-see. All right, so otherwise I hope you are all doing well, not just today, but through the whole holiday season. New Year's solstice just happened, so many blessings to you in the next coming year. All right, take care, everybody. Until the next one.